COVID booster shots will be offered in the U.S. beginning on September 20th. Seniors and frontline medical workers will be first in line. Now, those boosters are being recommended 8 months after you've been fully vaccinated. And joining us to discuss is Dr. Shikha Jain with UIC. Thanks for joining me this morning. Good to see you again. My first question to you right off the bat is there's been so much discussion about boosters. What do we know now that we didn't know before about why we need boosters?
It's a great question, Sylvia. So if you remember at the beginning of the pandemic, when vaccines first came out, we talked about the fact that boosters may be necessary, just like with many other vaccines that we give out regularly. The challenge with the COVID-19 pandemic and with these vaccines is that we've never seen this particular virus before, and we're using this mRNA technology. So now we know that a couple of months, about 8 months after you get your vaccine, there does seem to be a decrease in the antibodies that you're producing. And so the thought is that a booster will be necessary to help kind of boost up the immune system and give you a full immune response. I also want to remind people, typically when we give vaccines, we don't usually give them that close together. 3 to 4 weeks apart is a pretty close amount of time for which we gave our first and second shot. And that was because we were seeing so many people die from COVID-19. So there's a lot of thought that this booster is actually necessary because, one, our ability to fight off the infection is a little bit lower, our antibodies are a little bit lower, and this booster will help boost up our immune system, increase our antibodies, and increase the ability that we're able to prevent more people from getting COVID.
Okay, right now let's take a look at 2 studies that looked at vaccine effectiveness. There was one from New York, and it found vaccine effectiveness declined from 92% to 80% from May through July. Then there was another study, we have a graphic on that as well. A Mayo Clinic study found effectiveness declined from 76% to 42% with Pfizer. And if you got the Moderna vaccine, it went from 86% to 76%. So I looked up the effectiveness of the flu vaccine, and in a good year, it's considered 60% effective. Some years less, some years more. But one expert was quoted as saying boosters would only be warranted if these vaccines were failing to prevent hospitalizations. So that's the big question. Is that the case?
So it is absolutely not the case. At this point, all of these studies that you're talking about and the studies that have come out have actually shown that this vaccine is very effective in preventing sick people and preventing hospitalization. So the numbers that you're quoting just means that people who got the vaccine were at a higher risk of getting COVID-19, but most of the time they still had very mild symptoms. I think the reason there's a lot of concern is because we're looking down the line, and there's concern that if these numbers continue to drop, in the sense that more people can get COVID even if they're vaccinated, but a booster can prevent that, then maybe that will help the next surge and will help prevent people from spreading COVID after they're vaccinated. So again, I want to emphasize getting the vaccine still has a very, very high effectiveness of preventing you from getting hospitalized or getting very ill. The only concern is if you have the vaccine and you're 8 months out, are you at higher risk for contracting COVID than you were earlier on after you got vaccinated?
Okay, let's talk about another important issue that has come up several times, and that is the World Health Organization is still recommending the world's most vulnerable, of course, get the booster. But it says giving boosters to healthy, fully vaccinated people, that it's like giving a life jacket to someone who already has one. And I think their big push is we should be focusing on the unvaccinated. So what's your response to that?
Well, I think we can do both. I think the U.S. in talking about giving boosters to everybody is thinking ahead, and they're trying to prevent what they think might happen down the line as the vaccine effectiveness becomes a little bit lower the longer people have had those first 2 shots. I think we should absolutely be focusing on the unvaccinated. We should be focusing on our kids who are under 12 who can't get the vaccine yet and working towards getting them vaccinated. And we absolutely need to be looking globally and getting vaccines to those countries that don't have access, because if new variants pop up in another country, as we've seen with the Delta variant, that will impact the American population and it will impact the United States. So I think it's not an either or, it's an and. We need to both be vaccinating everyone and getting vaccines across the world to people who need it, but we also need to be talking about these boosters so we can protect especially our most vulnerable people who may not have as an effective of response of the vaccine and may need these boosters after 8 months.
There's also been a lot of talk about getting boosters of a different vaccine and if it's actually more beneficial. So let's hear what one virologist had to say about this, and I want your response.
There are some studies from the UK that have done AstraZeneca and Pfizer, because those are the two vaccines they've deployed. And they can see that, if you do AstraZeneca first, then Pfizer second, you get a better response than AstraZeneca and AstraZeneca.
Yeah, your reaction to that, interesting.
So AstraZeneca and the Pfizer vaccine have different mechanisms of action. So I can imagine if you got an AstraZeneca followed by a Pfizer, it would make sense that you'd have a more robust response. Now, what we're talking about for boosters in the US right now are the people who've gotten either Pfizer or Moderna. Those are both mRNA vaccines. So I've had a lot of people asking, I got Pfizer, should I get Moderna as my booster? And what I would tell people is right now, when it comes to boosters, we don't really know what the national recommendations are going to be as to whether you should get the same shot or a different one. But the thought that they both have very similar mechanisms of action, to me, makes me feel like if you got the Pfizer or the Moderna first, it would be fine to get either or for the second. Because they work similarly, I don't think we have any data or any evidence right now showing one is better than the other when it comes to a booster. So when it comes to getting your booster, I would say you should get either or, unless there's new recommendations that come out from the CDC or the FDA or the White House telling us that, in fact, you need to get the same drug again.
There are some people feeling left out because Johnson & Johnson, the question is, when will they need boosters? They have not released any word on that just yet, if you got the J&J vaccine. And will the booster be another shot of J&J?
So I think we're still waiting to hear more information on that. We're looking to see the data that comes out after the Johnson & Johnson data is released. We will likely need boosters after Johnson & Johnson, but I think the question is going to be, as you very aptly pointed out, is it going to be another Johnson & Johnson shot, or is it going to be one of these mRNA vaccines? And I think we'll hopefully know more in the coming days, but right now I don't have a good answer for you because we just don't know. We're still waiting for the data to advise all of those people who got the Johnson & Johnson vaccine.
So much more we have to take in again as we go into this latest surge. So I always appreciate your time. Thanks for joining me this morning.
Thanks, Sylvia.